Namaskar, I am Dr. Damanjit Kaur, consultant psychiatrist, Face Hospitals, Chandigarh. Today I am here to discuss about anxiety and social anxiety disorder to be in particular. What is an anxiety? Anxiety is persistent and excessive fear of the unknown, or it could be related to any object, person, or situation. Social anxiety or social phobia is a mental health condition. In this, a person is having excessive and persistent fear of being judged and evaluated by the other people around. So this can affect a person's life in a way in his or her performance at work, in school, and these people also find it difficult to make friends or keep up with their friendships. They have this anxiety in the situations where there are people around, for example, meeting new people, being on an interview, or eating or drinking in front of the others, performing on stages, or answering questions in the class. So these people have that excessive fear that they have beyond their ability to control this fear, and thus they avoid the social situations. Social anxiety, people sometimes do not have just the anxiety but also anxiety while performing. For example, performance in any sports activity or singing or dancing in the stage. Sometimes or mostly we have seen that this anxiety can persist for years and even lifetime if it is not treated. And if not treated without treatment, this anxiety can even hinder the person to reach up to his or her ability or potential. So what are the symptoms of social anxiety disorder? People, when they are in crowd or meeting new ones or in a party, they tend to have blushing, sweating, perspiration, tremulousness, feeling of nausea or stomachache. Generally, people do report that they have this feeling of mind going blank or freezing out, or they tend to have difficulty in talking with the strangers, or also because of this they avoid the social situations. So what are the reasons behind social anxiety disorder? Why do people have this disorder? So there are many factors. Most common factors I will be discussing, they are: number one is that there is previous childhood experiences which were negative in their life, like for example they have been teased or bullied, or they have been humiliated in front of the others, or there is any family dispute, trauma, or childhood abuse in the past. Family history of any anxiety disorder, especially in one of the parents, is also seen in patients with social anxiety disorder. Then the psychologists say that there is negative cognitive restructuring. What is that? The person is having learned negative behavior towards the social situations because of the past experiences. So then in future also this thought related to the situation is more bothersome than the situation, which led them to not to participate in these social gatherings. Then there is focus of attention of a person with social phobia is more towards the social interactions rather than on the situation. For example, person feels that for example, a person is dealing with is into a deal with the second party. He feels that if I will shake hand with the other person, I might tremble, and the person will come to know that I have lack of self-confidence related to the project, and this may lead that deal will not happen. So this kind of negative cognition is there in the person. Then there is a theory which is known as the cognitive theory. It has 4 components. I will be exemplifying the 4 components. Number 1 is overestimating the threat of the situation. For example, if the person is in this situation, he will think that the other person will going to judge me. उनको पता चल जाएगा कि I am having some social anxiety. Second is underestimating one's ability to handle the situation. Yes, I might not speak something stupid into the while I be performing, so this might happen. Third is expecting the negative outcome of the situation from the situation, that now the other person will come to know because of my behavior, he or she will come to know that I am stupid. Then there is overestimating the consequences of the situation. Now, for example, now the person has known that I am stupid, he will tell everybody around and my boss will come to know and then he will fire me from my job. So this kind of cognitive theory goes on in the mind of a social anxiety disorder or social phobia patients. Researchers and biologists have also told that there is increased activity seen in amygdala and hippocampus of the brain, which are the emotional processing areas of the brain. So what are the treatment modalities we follow when a patient comes to us having social phobia? There are two modalities we follow in our clinic. One is the medications and the other is the psychotherapy, or we do both of them. What is done in psychotherapy? Psychotherapy helps in unlearning the negative behavior or the cognitive behavior which person has learned. And therapy also helps it also teaches to think, behave and respond differently to a situation which was anxiety provoking in the past. Medications are given in cases of acute anxiety attacks and also in comorbid conditions. Social phobias are always associated with many comorbid conditions like panic disorder, depression, drug abuse, especially alcoholism is commonly seen. So medications helps in these kind of patients. So we try to have both the modalities provided to the patient, the ones who are having social phobias. How to prevent the anxiety? There's no hard and fast rule is there for detecting or predicting the social anxiety, that who will get the social phobia or how to prevent it. So there are some tips which I can share with you that how to manage your anxiety when you are in a situation. Number one is keep a journal about your anxiety. You should understand how do you feel. Write down your triggers, express your emotions, write down. When you get associated with your anxiety, you understand anxiety more and you will be able to take action easily on this. Avoid unhealthy habits of coping up with anxiety, that is excessive caffeine intake or alcohol intake. So avoid that. Thirdly is break the challenging situation into smaller parts and one step at a time. Yes, just make yourself relaxed with the smaller parts rather than onto the entire situation. Try some breathing relaxation exercises like deep breathing, or some yoga tips can be done before you indulge into any social gathering. Then get help early, sooner the better, it is said. Yes, if you get medical help early, you might be saving a lot of productive years of yours which could be hampered with this social phobia. Try to focus on what people are saying rather than assuming on the worst. So these tips you can always indulge yourself, inculcate in your life, which can help you to manage your anxiety. Stay safe, stay healthy. Thank you.